Hi friends, now we will present our presentation to you. This presentation could give you information about social phobia. Let us introduce ourselves. My name is Ariani Putri and my partners who will present the materials Senna Putra Wijaya, Muhammad Ramadhan, Christie Anggelo, Tiara Salsabila, and Oktavia Arvi. Okay, I won't talk too much. The next step will be present by my friend.
Hello, my name is Senna Putra Wijaya and my student number is 180811159 and I will explain the definition of phobia. Let's go. Phobia is an excessive fear of something or phenomenon. Phobias can be said to hamper the lives of those who have it. For some people, the fear of a person with phobias is difficult to understand. That is why the person often is mourned by his surrounding friends. There is difference in language between the phobic observer and a person with a phobia. Phobic observer use logical language, while a person with phobias usually use the language of text. For observer, it feels funny if someone is big. It's afraid of small animals such as cats or mice. And meanwhile, the mental image of a person with phobia of the subject becomes a very large, colorful, disgusting, or frightening object. Phobia is an escape mechanism for inner conflicts of a person's soul. There may be about 80 or even to 100 kinds of phobia known to people today. These phobia give rise to absurd and absurd fears. Usually, these phobias relate to hidden experiences which are deeply suppressed and forgotten. And phobia comes from Greek term phobos, which means to run, fight, fear and panic, fear, grief, fear, or terror. And this term has been used since the time of Hippocrates in Japan 1923. Argued that phobia is an intense and insurmountable fear of an ordinary situation and the task. Ross in 1937 said a phobia is a typical fear that the survivor realizes as something nonsense but cannot overcome it. And Elora in 1962 states that there is always fear an object or opinion which under ordinary circumstances does not cause fear. And thank you.
Okay, hello everyone. My name is Muhammad Ramadhan Deswantara. My identity number is 180818812. I want to explain what social phobia is. Okay, first, uh, social phobia is one of the anxiety disorders. The person with social phobia clearly and constantly feel uh, they feels anxiety or fear in one or many social situations. They also have negative thought about themselves, about other people's, about people interactions and social situation. They also feel judged in social situation. At the same time, they feel worried and aware of their symptoms. Uh, like symptoms of anxiety that they find cause others to have a bad impression of them or even cause humiliation on themselves. Um, okay. Next, they may also feel that everyone demands those around them and will judge someone by their social appearance, which means there there also feels like anxiety in social situation. Okay. In situation and social situation, people with social phobia may remain silent to avoid attention when faced with other people, like their communication when they're speaking with other people, they may blush or tremble easily. Yep. Step by step, they try to stay away from social situations because uh, they feel like anxiety. They have they however they are different from eccentric ones in that they simply do not like to behave that way. They also know that their anxiety is excessive, but they can't control themselves. Finally, they can only choose to pass their resolutions. Okay, enough. Enough my explain. Uh, Next, my friends will explain others material. Okay, bye.
Now, let's talk about factors that can cause social anxiety disorder. Similar to other anxiety disorder, social anxiety disorder can be caused by many factors, including environmental and physiological factors. There are three factors that I would like to discuss today. Let's start. First, let's talk about heredity. Social anxiety disorder somehow is related to heredity. But further research should clarify if there is a relation between social anxiety disorder with this heredity gene. Other research claims that social anxiety disorder can be involved or can be developed by imitating the behavior of family members. Next, after talking or after explaining about heredity, let's talk about neurotransmitter in the brain. Scientists found that there are a firm relationship between social anxiety disorder with the imbalanced amount of neurotransmitter in the brain. For example, neurotransmitter can be sensitive to serotonin that has responsible in monitoring and regulating emotions. Besides that, people who suffer social anxiety disorder maybe has a less dopamine, which this dopamine is another type of neurotransmitter. All of this can cause social anxiety disorder. Lastly, it is an overly reactive fear response. Amygdala is one of the brain structure that also play a role in monitoring and regulating fear response. Some scientists claim that people with social anxiety disorder maybe has a, an overly reactive amygdala, and it makes them become easily panicked and more susceptible to social anxiety disorder.
Hello, my name is Tiara Salsabila Marlis. Today I want to explain to you about symptom of social phobia. The first I want to tell you about physical symptom of social phobia. Number one is red face, like your face is become red, like blushing. Number two is short breath, you breathing like okay. Number three is stomach pain or nausea. Number four is trembling, including a shaking voice. Number five is heart palpitation or chest tightness. Number six is sweating or hot flashes. And number seven is feel dizzy or want to pass out. And next, I want to tell you about behavior symptom of social phobia. Number one is avoiding social situation to a degree that limit interaction or your interfere with your activities with your routine. And number 2 is avoiding eye contact. I think people with social phobia don't want to have any eye contact with another people or any stranger. And number 3 is silence or hide behind to avoid other people that notice your presence. I think this is very shy. And number 4 is need to always bring friends with you wherever you go. This is very very shy, I think. And number 5 is drink alcohol, before facing any situation, social situation, to try to calm down their body or their breath. And then often children with social phobia refuse to go to school because of the symptom they experience. And people with social anxiety disorder or social phobia may appear particularly in following situation like dating, make a contact with another people, interact with stranger, eating in front of other people, and they don't want to work or just to go to school. I think they don't want entering a room full of people. And the last is, I think, people with social phobia don't want to attend a party or just a family gathering or another gathering. Okay, that's all of my presentation. I hope you like it. This my explaining is you understand with whatever I explain in this video. Thank you very much. Bye bye.
Okay, it's my turn to explain the difference between antisocial, shy, and social phobia. Shy is natural human emotion, trait, or instinct. Social disorder is a mental condition that is not deserved by a person. That is, social phobia is natural. And antisocial is a behavior that is not accordance with social norms. For example, the environment is not for a smoker, but he smokes.
Hello, my name is Oktavia Arvi, and now I will explain about phobia treatment. Social phobia therapy. To overcome social phobia, psychiatrists can use two methods: psychotherapy and administering drugs, which are described below. 1. Psychotherapy. One form of psychotherapy to overcome social phobia is cognitive behavioral therapy. This therapy aims to reduce anxiety in sufferers. The patient will be faced with a situation that makes him anxious or afraid. Then a psychologist or psychiatrist will provide a solution to face the situation. Over time, it is hoped that the patient's confidence will increase to face the situation, even without assistance. Cognitive behavioral therapy lasts for 12 weeks. This can be done alone with a psychiatrist or in group with other social phobia therapists. The psychiatrist will also provide an understanding to the sufferer's family about this disorder, so that they can provide support to sufferers to recover. 2. Medicines. Several types of drugs can also be used to treat social phobias. The psychiatrist will give the drug in a light dose first, then increase it gradually. A number of drugs used for social phobia are anti-anxiety or anti-anxiety drugs. Medications such as benzodiazepine can reduce anxiety quickly. Antidepressant drugs. Apart from treating depression, antidepressant drugs can also be used to treat social phobia. In contrast to antidepressant drugs such as fluoxetine cannot work quickly and are used for long periods of time. Beta blockers. This medication aims to treat physical symptoms to arrest due to fear or anxiety, namely palpitation. The drugs used include bisoprolol. The results of treatment for social phobia are not always immediately obvious. Sometimes survivors even need to take medication for years to prevent recurrence. So that the results are optimal, do the treatment according to the doctor's recommendation and regularly discuss with the doctor about the development of the disease condition. Thank you.
Ladies and gentlemen, finally we come to the end part of our presentation. We would like to say thanks again, guys. Hopefully this presentation will be beneficial for you all. Thank you for the attention.